Well, with the gas leak in Porter Ranch entering its 7th week now, residents who have chosen to stay inside their homes are starting to worry about the possible long-term health risks, and many are hearing conflicting stories. Welcome back to CBS 2 News at 5, everyone. I'm Suzie in tonight for Pat Harvey.
And I'm Paul Majors. In the beginning, county health officials said the gas leak did not pose any long-term health risk. However, just last week, Cynthia Harding from the county's Department of Public Health wrote in a memo to county supervisors, as the duration of exposure increases, these trace levels can produce significant long-term health effects. Well, joining us now with some answers is Dr. Cyrus Rangan. He is the Director of Toxicology and Environmental Assessment for the county. And Doctor, what do you say to those people who live there who are getting one story than another story?
Sure. I think that what we're viewing here is an ever-evolving situation. We have, at the beginning of this situation, a gas leak where we were given the impression that it might be fixed within a few days, maybe a week. And at that time, we had some assurance that people would not incur any kind of long-term kind of health risk from this. But as this situation has evolved, as you mentioned, we're into our 7th week now, it gave us pause to say, now we need to really look at all the chemicals of concern that may cause long-term health risks. Fortunately, all the readings that we have so far indicate that we still are not at risk of long-term health effects or permanent health problems from this exposure. But we need to monitor this stuff every day because this is an ever-evolving situation.
Well, what is the chemical that you're most concerned about?
There are a number that we're concerned about. The one that we're concerned about the most in terms of the symptoms that people are getting there are these sulfur-based compounds, which are the compounds that we add into natural gas to give it its characteristic smell. And it's those odors that are causing a physiologic response in the body which give rise to the symptoms such as nausea, abdominal discomfort, or dizziness, or headaches, or even shortness of breath and nosebleeds. So these are real symptoms that are occurring in people in and around the Porter Ranch area.
What about in the repair process? Radon could be released, and we know that it's a problem for people. Causes lung cancer in non-smokers even.
Sure, this is a theoretical possibility, and when you are addressing a problem that may be several hundred or maybe even several thousand feet deep, you may generate what are called preferential pathways for something like radon beneath the Earth's surface to make its way up to the surface. So primarily our concern about radon is from the worker exposure for the people who are actually doing the repair job. And if we find radon there, then we can address that situation. And if radon does exist in the work site, then we may need to even look at the residential community and monitor for it there too.
I think this is a question that many of the residents want to ask SoCal Gas themselves, but I'll ask you, Doctor.
Sure.
If this was your family, if this was you were in this situation, would you leave your family there?
I think the message here is that if you are living in that area and you're not smelling anything, by all means stay in your house, and I would do the same. If you smell something and you are not having symptoms, or you can tolerate the mild symptoms that you do have, by all means stay in your house. But if you are smelling stuff, and you are experiencing symptoms, and you find those symptoms to be unbearable, whether it's in you or your children, anyone else in your family, then take advantage of the voluntary relocation assistance program that the gas company is providing.
All right. Doctor, thank you very much for being with us. We appreciate it.
No problem.